Welcome back to my channel, PsyDesign. My name is John, a PsyD student in clinical psychology, and this is episode 2 in the Foundations of Psychological Assessment series. In this episode, we're going to cover one of the most important and most commonly misunderstood distinctions in psychology, which is psychological testing versus psychological assessment. This difference shows up everywhere in training, clinical work, and ethics, so getting this clear early really matters. This distinction matters because confusing testing with assessment can directly impact diagnosis, treatment planning, and ethical decision making. Early in training, it's very common to hear people use these terms interchangeably, but in clinical psychology, they are not the same thing. Understanding the difference helps prevent over reliance on scores and supports more thoughtful, responsible clinical practice. Psychological testing refers to the administration of standardized instruments. These tools follow manualized procedures, have established norms, and produce scores or data. Testing is structured and standardized by design. As a PsyD student, we're trained to administer tests carefully and consistently, but it's also emphasized that testing alone does not equal assessment. Psychological assessment, on the other hand, is an integrative clinical process. It involves multiple sources of information, interpreting patterns, and applying professional judgment. Assessment is where clinical reasoning happens. This is where we move beyond scores and start asking what those scores actually mean for this person in this context. Testing is one component of assessment. It's only one piece of the larger picture. A full assessment may also include clinical interviews, behavioral observations, collateral information, and records review. No single data source should be interpreted in isolation. In training, this idea is emphasized repeatedly. Assessment is about integration, not accumulation. Here's a high level way to think about it. Testing might give us a score from a single measure. Assessment takes that score and considers it alongside the person's history, observed behaviors, developmental background, and current context. The same score can have very different meanings depending on the broader clinical picture. There are a few common misconceptions that show up early in training. One is the belief that a single test equals a diagnosis. Another is that scores speak for themselves. And another is that more tests automatically lead to better assessment. In reality, none of these are true without thoughtful interpretation. Over relying on tests can lead to real clinical risks. These include misdiagnosis, increased cultural bias, and ignoring how someone functions in their real world environment. Tests are powerful tools, but only when used thoughtfully and within context. Clinical judgment is what allows us to synthesize converging and diverging data. It helps us weigh limitations, recognize inconsistencies, and apply ethical reasonings. This is one of the key differences emphasized in PsyD training. Assessment is not just technical skill, it's professional judgment. Ethical standards reinforce this distinction. Clinicians are expected to use multiple sources of data, avoid single test conclusions, and practice within the areas of competence. Ethical assessment requires both technical knowledge and reflective judgment. So, the main takeaways from this episode are Tests support decisions, assessment guides conclusions, and clinical judgment is essential. Keeping this distinction clear will strengthen your assessment skills throughout your training and beyond. In the next episode, we'll cover another foundational concept that builds directly on this discussion: reliability versus validity, and how to think about them simply and clinically. If you found this episode helpful, please like the video. It really helps the channel grow. If you're a psychology student, trainee, or clinician looking for structured, clinically grounded content, make sure to subscribe and stay tuned for the next episode in the series on reliability versus validity.